Okay. Good morning, classmate. Good morning, ma'am. So for today, I will show to you on how are we going to use our stethoscope and also our sphygmo manometer. So, but before we proceed to our to use our equipment, so let us know first what are the labels of our equipment. So first is we have the stethoscope. So we have here the earpiece, we have the ear tube, we have the tubing, and we have the bell, and also we have the diaphragm. Second is we have here the second equipment, which is the sphygmo manometer. So the first one is we have, we need to know also the labels, okay, for us to secure the safetyness of our patient. So first is we have here the bulb, we have here the valve, we have the tubing, we have the cage, and we have the cup. Okay, so before we use our equipments, so we need to make sure that we already clean those equipments to prevent further infections from our patient. Okay, so let us now start our procedure for to our patient. Before we proceed, let us know first what are their names. So we're going to ask our patient about their name and also the birthday. Why we need to ask their name and also the birthday? To secure that this is our patient. Okay, so ma'am, what is your name again?
Sheila Malyari.
Sheila Malyari. And also your birthday, ma'am?
February 26, 19.
February
26,
26,
1982.
1982. So for today, ma'am, I am your caregiver for this morning. So is it okay for you to get your blood pressure as well as the thermometer and also your signature at the end of this session po?
Sure.
Okay. So again, we need to make sure that our equipment is safe for our patient. So let us clean first our, first is we have the stethoscope. So we need to get one piece of cotton balls, then put some alcohol, then clean first the earpiece. So once we use the cotton balls in the certain part of our equipment, so we're going to dispose those cotton balls. So example, this one, get again a cotton balls, then put some alcohol, clean the ear tube, okay, then as well as the other parts of our equipment. So next is our sphygmo manometer. So we're gonna clean also this for the safetyness of our patient. So just imagine na I already cleaned this sphygmo manometer. So let's start now on how are we going to use the blood pressure equipment. Excuse me, ma'am. Okay, in putting the cup to our patient, okay, so we need to make sure that there is a two distance, okay, two allowance from the tracheal artery. So it looks like this. So then after that, we need to put our cage from the okay, from the cup. Okay, I forgot. But before we proceed to checking first the blood pressure of our patient, we are going to ask first the history of their blood pressure before. Okay, ma'am, what is your blood pressure before?
137.
Okay. Okay, ma'am, your blood pressure is 140/80 po. Okay, so aside from that, after we get the blood pressure of our patient, we need to put our equipments in a safe place also. At the same time, after that, we need to clean again the equipment for the next patient that we're going to get their blood pressure. And also, don't forget to write those information that you're going to get for your patient, because this will be one of your documentary when it comes on asking by the patient's relatives. So, 140/20. 80, sorry. Okay, next in getting the pulse rate, so we need to have at least our clock 1 minute. Okay, 1 minute to get our pulse rate. So time check is 21:59. So. Okay, ma'am, your pulse rate is 81 po. Next is we have the thermometer. So again, we need to clean it first before the patient use this equipment. So get a cotton balls, then put some alcohol, then clean our thermometer. Then discard. Okay, for us to know what will be the answer for this thermometer, so let us wait first the ring. Okay, yung ring na maririnig natin dito. Okay, ma'am, your degree Celsius is 37.2. Okay, so again, before we put it beside the mess, so we need to clean it first. Okay, get a cotton balls, then put some alcohol, then clean our thermometer, then off, then discard the cotton balls. So for the last one is we have the respiratory rate. So in getting our respiratory rate, so we need to have 1 minute also. Then we're gonna look at their shoulder. Okay, so the counting for the respiratory rate is inhale then exhale count is 1, inhale exhale count is 2, inhale exhale count is 3, and then so on and so forth. So ma'am, time check is 10:30, 10:03. So, wait lang po. Go po. Okay, ma'am, so your respiratory rate is 17. So it is normal. And ma'am, could you please sign here to my documentary? So this will be the proof that you accept to get the blood pressure, the thermometer, respiratory rate, and also for the pulse rate. So thank you so much po, ma'am. Then thank you po. So after we thank you for our patient. So let's proceed first to those equipments that we use to our patient. So again, before we leave the room or before we leave our equipment, so make sure that those equipments are clean. At the same time, we're going to put it inside the it's either a container or in a bag or even in drawer. So, yun lang po. Maraming salamat.